Have you ever heard of a surgery where the doctor sees inside your joint without making those big cuts? Sounds futuristic, right? Well, that's exactly what arthroscopy is. Hi, I'm Dr. Amardeep, your orthopedic surgeon from Shivam Hospital, Basveshwar Nagar. And today I'll explain you what arthroscopy is and how it is a game changer in the treatment of sports injuries. Arthroscopy is a minimally invasive surgical procedure that allows us to look inside your joint using a tiny camera called an arthroscope. We make just 2 or 3 small cuts, each of about 1 centimeter, just a buttonhole size of cuts we do on your skin. We insert the cameras and some special tools and we see the video. That camera will show the video to a big monitor outside, wherein we'll be seeing the monitor and we will be analyzing the ligament status of your joint, cartilage status of your joint, and the joint surfaces in a great detail. Even a 1 mm small defect can be seen as a huge one in the camera. That's with some buttonholes we do this. And the best part is we don't just look at it, we also treat those tears, remove the damaged tissue or smoothen the surfaces all through these small buttonhole incision of 2 to 3, just 1 mm size. So now why is it great for sports injuries? Sports injuries are often involve ligament tears, cartilage damage or meniscus injuries, especially in the knee, shoulder or ankle. With arthroscope, we can diagnose and treat the ACL tears in your knee, rotator cuff tears in the shoulder, meniscus injuries, cartilage damage, and even any loose bodies floating in the joint can be removed. So by going inside the joint, we just don't see what and all is damaged. We can treat it simultaneously with even with those smaller incisions only. This technique has many advantages. It causes less trauma to healthy tissues. We don't want other healthy tissue to be damaged by giving big cuts. The recovery time is faster than open surgery. Obviously, the more you cut, the more time to heal. Here the cutting is less, that healing is faster. There is less pain and scarring. Patient often return to sports sooner. For example, an athlete with an ACL tear can undergo arthroscopic ACL reconstruction and be back to training in a few months with the right rehabilitation. So how we'll talk about the recovery and the rehabilitation. After arthroscopy, most patients go home the same day. Physical therapy, the physiotherapy usually begins within a few days to strengthen and flexible your joints, and that is guided with the guidance of your orthopedic surgeon who has operated it. The exact recovery time depends on the type of injury, the procedure done, but overall it's faster and smoother than our traditional open surgeries. Then arthroscopy has changed the way we treat sports injuries. It helps athletes heal better, faster and get back in the game. If you are someone you know is struggling with a joint pain or a sports injury, consult the orthopedic specialist and see if arthroscopy is right for you. This is a game changer in the field of ortho sports medicine, wherein with a small incision we are treating big ligament tears and everything. Like this video, share it with the teammates, and don't forget to subscribe for more tips and bone and joint health tips. See you in the next video.